We're your own first case study. So working with Blue Cross and Blue Shield, seeing an increase on about maybe 30, 35 employees. And you were like, well, if I want to take this strategy to employers, we need to figure this out.
Practice what you preach.
So, looking at an independent TPA, looking at an independent PBM, we worked with a regional network, and bolting on the, direct primary care with the major medical, because that's the number one thing that we get from a question standpoint from the C-suite. Okay, direct primary care sounds great, but how does this coincide with or work with our health plan? And yes, you can, attach these services to one of the big insurance carriers, but you're not necessarily doing yourself a financial favor, because they're also saying, well, we've seen increase after increase, and now you're asking us to pay for this additional benefit.
And on a fully insured plan, you're not benefiting. We can save Blue Cross Blue Shield or some other large insurance company a bunch of money, but that's never what I set out to do. Setting out to save the employer dollars so they can take care of their employees was the goal. So we were able to add the benefit, reduce the cost, reduce deductibles, premiums, everything. First year. What were you able to do with that savings? We were able to wrap it back into other benefits. And then it also allowed for extra cash flow in the expansion, trying to get everything up and running. So those dollars could be added back into taking care of the organization and the employees that take care of the people that we take care of. And I think, we'd looked at it, Colton, and it was from when we first implemented going self-funded, level funded, and moving through the last 3 years. I think we're at almost $750,000 in savings, despite the fact that we've doubled our enrollment. So the standard rate increase would have been really, really harmful to our business.
And that's happening to businesses across this country where they can't invest in R&D. They're making tough decisions every year where they pass the cost of the increase onto the employees, the contributions, and we raise deductibles. And so now we have people that are functionally uninsured in this country. And I think it's also important to point out, when we blow up the health plan, I love that, it's going to be my new one, and we rebundle it with like-minded folks, we get decrements in the reinsurers, and they know that we're playing ball. And we have reinsurers that say, look, we're really like you and Colton, but we're not going to work with you unless you plug in a DPC model. And so this is also being repeated with our employers. And seeing that other side of the coin for me is, again, another moment of truth where we wanted to do case studies, and I kept on telling Colton, I said, this is going to be really hard to sell this type of product because people are saying it's too good to be true, or they'll say, you've heard employers, now that you've jumped into the broker wagon kind of, where you sit in front of employers that are like, we've tried these things before, it's been a disaster, and the people that are making these decisions are not necessarily economically fit to try to really understand the complexities of this. But when I have people calling me literally, and I know I'm on TV here, folks, but they're in tears. Because we do have friends with the program when they have acute issues, when they need an MRI or they need to have surgical services for musculoskeletal. And we actually brought in a bariatric surgeon in our program now. So when someone calls up and says, I didn't have to pay $3,000 for my deductible or my out-of-pocket maximum, that's a huge thing for
a functionally uninsured, somebody who's lived in that world. And for those who don't know what that means, it means you have insurance, but you have a $5,000 deductible, and you don't have, that was middle of the road.
I was going to say,
despite the fact that you're $20,000 in on your family plan and premiums, you've got a bunch more.
That's your first deductible.
Exactly. Then you got to get all the out-of-pocket paid to get the product to do anything. I mean, it's just insane